My name is Angela Hed, and my background is in health sciences. I graduated from James Madison for undergrad with the Bachelor's of Health Sciences, and my minor was anthropology. And then I'm now a student at UConn for MPH program, so the public health program. I'm a full-time student, and I will be graduating this May. Ultimately, what made me pursue my MPH is I just didn't feel like my bachelor's degree had gotten me as far as I would like to be. I wanted to have a career in public health. I decided I didn't want to be clinical, but I still wanted to do something more and contribute. And I just wanted to ultimately just get myself a little farther, and I felt like getting my MPH would get me there. So back in August of 2023, I received an email that they were looking for students to be involved in this internship. So I decided that I would be willing to try to pursue that despite having a full-time job. I figured I could make that work with my full-time job. So ultimately I got involved because they sent that email out and I was interested in getting some more public health experience before graduating. My role, currently I'm an intern at Bristol Burlington Health District. I am an intern there they had us pick between two different projects, and I'm working on a hepatitis C project. They have higher rate of hepatitis C for the town despite the population, so it's just not quite proportionate to the size of the city. So what we've been working on is we developed a survey to be distributed in the town to get a little bit of their feedback and perspectives on what needs to be done in the town to help address those rates, as well as we have now analyzed that survey data, as well as been working on applying for grants and things to get funding to fund hepatitis C intervention programs. So we had a couple challenges in that we had, for our survey, we wanted to distribute that to multiple physicians in the area. Unfortunately, a lot of them did not want to take on additional research at this time. So we did end up only being able to distribute to 2 different places. So we just had to kind of work with what we could. And then one of the other problems is that I haven't been able to find a grant program that has been that covers the whole range of hepatitis C related issues. So we did find one to apply to that only provides funding for the linkage to care portion, but not the diagnostic side. So it doesn't help people get diagnosed, but it does help people at least continue to get care after they've been diagnosed. But that has been something that we haven't been able to find, is the assistance with the diagnostic side. So the funding from this grant's been great because it did help take a little bit of that financial burden off. But additionally, I have been able to get experience developing surveys as well as collecting that data and analyzing that data. I've also been able to go out with sanitarians to shadow what they do, see some inspections in the area. Additionally, we've also gotten to do some grant writing and actually searching for grants, things like that. So that's been great. So ultimately, this has been great for me because I have not really had any experience in public health before this internship. So it's been great to get those skills before we're heading out into the workforce this May, as well as also just getting that experience in general, to getting to see kind of what other areas in public health do.